Hello everyone, and thank you for your interest in the 2021 Tuscarawas County Community Health Needs Assessment. My name is Gabby McKinnon, and I'm the project manager of the Tusc County Community Health Needs Assessment, and I work for the Hospital Council of Northwest Ohio, outside of Toledo, Ohio. If you started here to review the Tusc County adult data, I wanted to start off by mentioning there is an additional presentation posted to review the methodology of the Community Health Assessment. For example, you will find information regarding the design, analysis of data, and response rates. Additionally, this presentation is only focusing on the general adult population. Please check out the additional presentations to review the youth portion of the assessment. I wanted to take a minute and specifically talk about how the COVID-19 pandemic affected the process of this community health needs assessment. First, data collection for both the adult and youth surveys did take place during the COVID-19 pandemic in August through October of 2021. With the COVID-19 pandemic affecting the lives of the Tuscarawas County residents, uneasiness grew around data collection. As mentioned in the methodology presentation, the total sample size was only 208 residents, resulting in a 6.78 confidence interval. The youth population had a total sample size of 699, with only 37.5% of Tuscarawas public school districts participating. During the youth data collection, there was an increase in the local school COVID cases, which ultimately impacted the total sample size. The first section we will be reviewing from the health assessment is healthcare access. The sections underneath fall into this category within the health assessment. I want to mention that the full Tuscarawas County Community Health Needs Assessment is over 150 pages. We will only be touching on a fraction of each section to give you a general overview of what type of data you will find in the full health assessment. Starting with healthcare coverage, 87% of adults had health insurance, which leaves 13%, which is approximately 9,066 adults who are uninsured in Tuscarawas County. Tusc adult healthcare coverage included the following: medical at 97%, prescription coverage at 94%, immunizations at 78%, preventative health at 73%, outpatient therapy at 71%, and dental at 68%. The following pie chart shows sources of healthcare coverage for Tusc County adults. The top three sources in order were employer, Medicare, and someone else's employer. You will also see options reported out as military, self-purchased, the marketplace, and private insurance. The first graph that you will see in this presentation is reporting those who are uninsured in Tusc County. To explain this graph a bit, you will see the very first bar on the left as the 2021 percentage total. Then as you move to the right, you will see the data broken down by gender, age, and income. Lastly, as you look at the orange bars to the right of the graph, you will see old Tusc County data from previous health assessments. This is why it is so important that we ask the same questions from year to year so we can look at changes in the data throughout the years. At the bottom of the slide, you will see comparisons starting in 2015 for Tusc County. Additionally, we incorporate the national and state level comparisons to be able to look at how Tusc County is doing in comparison to Ohio and national data. Moving to the healthcare access and utilization section, you will see 77% of adults visited a doctor for a routine checkup in the past year. The top reasons adults went outside of Tusc County for the following services were: services were not available locally, 27%, which is approximately 18,830 adults. did not like the local services or providers at 19%, better quality of programs 17%, used to live there 15%, and insurance restrictions at 12%. The following were the top places adults visited when they were sick or needed advice about their health. Doctor's office at 46%, urgent care center at 4%, family and friends 4%, internet, veterans affairs, and public health clinic or community health center all at 2%, hospital emergency room and chiropractor both also at 1%. Preventative medicine is next. This section encompasses vaccination data for Tusc County adults. We see 50%, approximately 34,870 adults of the population reported receiving a flu vaccine in the past year. The top vaccines adults received were MMR in their lifetime at 79%, COVID-19 in their lifetime, and tetanus booster in the past year, both at 67%. Our comparisons are also showing vaccination data. Tusc County's flu vaccination rates are both over the U.S. and Ohio rates. Next, we have specific sections for both women's and men's health. Both sections include data on preventative exams. For women's health, we are looking at clinical breast exams, mammograms, and pap smears. Overall, 56% of women aged 40 and over had a mammogram in the past year. 87% of women had a clinical breast exam at some point in their life, and 55% had one in the past year. 86% of women had a pap smear at some point in their life, and 38% had one in the past year. Women use the following as their usual source of services for female health concerns: private gynecologist at 57%, general or family physician at 19%, and health department clinic at 4%. We also realize that screening recommendations change depending on the recommendations of different organizations. We are following the CDC's guidelines for these questions within the adult comparisons. Screenings for mammograms, clinical breast exams, and pap smears increased from 2018. For men's health, this slide is looking at prostate-specific antigens, also known as PSA tests, and digital rectal exams. Overall, 57% of males had a PSA test in their lifetime. 80% of males aged 50 and over had a PSA test in their lifetime, and 47% of males had a digital rectal exam in their lifetime. Our last section falling under healthcare access is oral health. First, 64% of adults visited a dentist or dental clinic in the past year, decreasing to 42%, approximately 29,290 adults of those with lower incomes. 67% of adults with dental insurance had been to the dentist in the past year. And the main reason adults did not see a dentist was no reason to go or had not thought of it at 20%. Next, we break down those visiting a dentist in the past year the same way you have seen in previous graphs. The lowest percentage seeing a dentist in the past year was for those with lower incomes and highest for those with higher incomes. At the bottom of the slide, you will see the overall percentage of 64% being slightly lower than the Ohio and US rates. The next section we will be looking at is health behaviors, which is one of the largest sections in the full health assessment. First, we are looking at health status perceptions. This section in the report is adults reporting on how they perceive their overall health, both mental and physical. The graph is looking at overall general health being rated as excellent or very good, good, and fair or poor. The lightest color at the very top of the graph is showing fair or poor health. When looking at fair or poor health, we see the highest rate for those with lower incomes. .24%, or approximately 16,737 of Tuscarawas County adults rated their physical health as not good on 4 or more days in the previous month. 29%, or approximately 20,224 of Tuscarawas County adults rated their mental health as not good on 4 or more days in the previous month. Our comparison table for health status perceptions is quite larger than some of the past ones that we have reviewed. Average numbers of days that physical and mental health was not good did decrease from 2018. Another large section, weight status, includes information about nutrition, BMI, and physical activity. We can see here that 69% of adults were either overweight at 26%, approximately 18,132, obese at 24%, approximately 16,737, severely obese at 12%, which is 8,369, or morbidly obese at 7%, which is approximately 4,882 adults, by body mass index, also known as BMI. 39% of adults were trying to lose weight, 31% were trying to maintain their current weight or keep from gaining weight, 1% were trying to gain weight, and at the bottom you can see comparisons of those broken down by obese and overweight compared to the Ohio and US. The BMI graph is broken down into those who fall into normal weight, overweight, and obese categories. The top and darkest color is indicating obesity. The highest percentage of those who were obese were those ages 19 to 64 at 48%, and those with lower incomes at 46%. The top 3 barriers reported to consuming fruits and vegetables were too expensive at 12%, no variety at 2%, and did not like the taste at 1%. Top 3 reasons adult Tuscarawas County residents chose the food they ate were taste and enjoyment at 64%, cost at 49%, and ease of preparation and time at 44%. And last, adults obtained their fresh fruits and vegetables from the following: large grocery store at 83%, farmers market at 39%, and grow their own garden at 36%. Now we will be looking at tobacco use. Tusc County current smoker percentage is at 16%, which is approximately 11,158 adults. Keep in mind current smokers is just looking at cigarette smoking. 18% were former smokers, and cigarettes are still the top tobacco product, with e-cigarettes as the second most popular. The graph on this slide is looking at smoking behavior for Tusc County adults, with current smokers depicted as the lightest color. 24% of those with lower incomes are currently smoking, followed by 21% of males. Current smokers in Tusc County is lower than Ohio and the same as US. The former smoker rates dropped by 8% from 2018 to 2020. Next, we are reviewing alcohol consumption data for Tusc County adults. 46% of adults had at least one alcoholic drink in the past month. This is defined as a current drinker by the CDC. 17%, or approximately 11,856 adults, were binge drinkers, which the CDC defines as 4 or more drinkers on occasion for females, and 5 or more drinks on occasion for males. For comparisons, current drinkers went down 4% from 2018, and binge drinkers went down 1%. As I mentioned, 1 or more days drinking in the past month is defined as a current drinker. The slide is looking at the average numbers of days adults were drinking, with the lightest color meaning 3 or more days in the past month, and the brown meaning did not drink any days in the past month. Now we are looking at drug use. 4%, or approximately 2,790 adults, had used recreational marijuana in the past 6 months. Adults reported that they and/or an immediate family member or someone in their household used the following in the past 6 months: CBD oil, 8%, recreational marijuana, 7%, medical marijuana, 5%, and wax or oil with THC or edibles at 4%. 5% of adults used medications not prescribed or took more than prescribed to feel good or high and/or more active or alert, increasing to 14% of those with lower incomes. We have a few graphs to break down recreational marijuana and prescription drug misuse. Those using recreational marijuana in the past 6 months, most noteworthy are males and those ages 19 to 64 at 7%. This next graph is looking at medication misuse in the past 6 months, with the highest percentage of those misusing being those with lower incomes at 14%. Our next section falling under health behaviors is sexual behaviors. 69% of adults had sexual intercourse in the past year, and 2%, approximately 1,395 adults, reported having 1 or more partner. Too old, no partner, and vasectomy were the top methods used for birth control. This graph is indicating the number of sexual partners in the past year. The middle area, which is the light brown, is indicating more than 1 partner in the past year. This is the highest for those 19 to 64 years old at 4%. Our last section under health behaviors is mental health. You will see the first bullet showing 1%, or approximately 697 adults, seriously considered attempting suicide in the past year. 2% made a plan about attempting suicide, and 0 actually attempted suicide. We do not have comparison data here for Ohio or in the US since they are sensitive topics. The full report has some secondary data surrounding this topic. To finish up the mental health section, you will see the following cause adults anxiety, stress, or depression. Job stress at 27%, current news, world events, political environment, and COVID-19 both at 24%. Financial stress at 22%, death of a close family member or friend at 17%, marital or dating relationship 13%, fighting in the home 12%, other stress at home, and sick family member both at 10%, poverty and no money at 9%, and family member with a mental illness at 8%. Our next section is chronic disease, which encompasses the sections you see on this slide. We will first start with cardiovascular health, which will look at those diagnosed with high blood pressure and high blood cholesterol. Five percent of adults reported they had survived a heart attack. 3% of adults reported they had survived a stroke. 2% of adults reported they had coronary heart disease, and 2% of adults reported they had congestive heart failure. Next, we are looking at those diagnosed with high blood pressure. The highest rates we see are those 65 and older at 61%, and those with lower incomes at 74%. Now we are looking at those diagnosed with high blood cholesterol. The highest rates we see are those 65 and older at 60%, and those with lower incomes at 51%. We see those who had a stroke, been diagnosed with high blood pressure, and blood cholesterol checked within the past 5 years all increased from 2018. Next, we are moving on to cancer, with 16% of adults diagnosed with some form of cancer in their lives, increasing to 37% of those ages 65 and older. Of those diagnosed with cancer, the top cancers reported were other skin cancers, prostate, and breast cancer. Now we are looking at arthritis. 39% of adults had been diagnosed with arthritis, increasing to 67% of those 65 and older, and 76% of those with lower incomes. Next is asthma. 13% of adults had been diagnosed with asthma, increasing to 32% of those with lower incomes. Next, we are looking at diabetes. 14% of adults had ever been diagnosed with diabetes. You can also see adults diagnosed with diabetes also had one or more of the following conditions. 89% were diagnosed with high blood pressure, 85% were obese or overweight, and 71% were diagnosed with high blood cholesterol. This graph is breaking down those diagnosed with diabetes, with the highest percentages being 65 and older at 24%, and those with lower incomes at 33%. Our last section for chronic disease is quality of life. This graph is looking at adults who reported most limiting health problems. Arthritis was reported as the top limiting health problem for Tuscarawas County adults. Our last section of this presentation is social conditions, which encompasses social determinants of health, environmental conditions, and COVID-19. According to the CDC, social determinants are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life outcomes. The section is divided into 5 key areas of the social determinants of health, which are economic stability, education, social and community context, health and healthcare, and neighborhood and built environment. 10% of adults needed help meeting their general needs, such as food, clothing, shelter, or paying utility bills in the past month, increasing to 31% of those with incomes less than $25,000. 5% of adults had to choose between paying bills and buying food. 2% worried food might run out, 2% went hungry or ate less to provide more food for their family, and 1% experienced a loss of income that led to food insecurity issues. This next slide is looking at adverse childhood experiences, or ACEs as we like to call it in public health. These adverse experiences are traumatic events that occurred during childhood. So the question states, did any of the following occur under the age of 18? Some of the options are experience violence, abuse, witnessing violence, or having a family member attempt or die by suicide. These ACEs are linked to chronic health problems, mental illnesses, and substance misuse in adulthood. This question was actually asked in all of our populations surveyed in the health assessment, so you are able to see how this changes across the spectrum. For our adult ACEs question, we look at those who experienced 4 or more. 14% of adults experience 4 or more ACEs in their lifetime. %11 of adults had at least one of the following transportation issues. Could not afford gas at 4%, no car at 3%, other car issues or expenses, suspended or no driver's license, did not feel safe to drive, all at 2%, followed by disabled, limited public transportation available or accessible, no public transportation available or accessible, and no car insurance, all at 1%. Next is the environmental conditions section. One main question asks, what is threatening adults' health in the past year? The top answers were insects, mold, and air quality, and unsafe water. Last is COVID-19 and how it impacted adults and their families. The following are the top issues that negatively affected adults and their families. Change in mental health at 17%, change in physical health at 15%, not seeking health care at 13%, and educational challenges at 11%. Thank you so much for your time and interest in the results of the 2021 Tuscarawas Community Health Needs Assessment. Please remember to review additional sections of this presentation that you may be interested in, including the youth data. Before we finish, I also want to encourage you to fill out a participant feedback survey with more information on the next slide. Here you will see the link to our participant feedback survey, which is on the SurveyMonkey platform. We ask questions that will help the Healthy Tusc members move forward with planning for their community health improvement plan, which is the next step in this process. When community leaders consider the priority health needs for Tuscarawas County, it is helpful to use data from the above survey along with data from local organizations in the County Health Rankings report, since the most recent Community Health Needs Assessment report does not represent a complete picture of the health of county residents.